wrote it down. I think it like does something with its receptors. But anyways, however, it does have the side effect of dyskinesia, which means dysfunctional movement. Lots of movement. There's also like surgery, antihistamine, specifically diphenhydramine, has some anti-acetylcholine effects. Acetylcholinergics can block acetylcholine and kind of sort of restore that balance between dopamine and acetylcholine. And then we have other dopamine agonists like amantadine,
yeah.
Which increases dopamine release and blocks receptors. So again, that kind of sort of restores that balance between acetylcholine and dopamine. Complications of Parkinson's all have something to do with its, I think I said at the beginning that Parkinson's is a both motor and sensory neurologic disorder. I don't think so. I think it's motor. It's a motor disorder.
Yeah, you said it. Yeah.
So, with that said, the complications of Parkinson's all involve the motor dysfunction associated with the disorder. So, dysphagia, we see dysphagia as a complication of Parkinson's because they need to move their muscles to swallow. Dysphagia is difficulty swallowing, but with Parkinson's, we have dysfunctional motor function. So we see difficulty with swallowing. Related to that, the difficulty swallowing, we see malnutrition and aspiration. Malnutrition because they're having trouble getting the nutrients that they need into their GI system and stuff. So they might lack some nutrients. Aspiration, difficulty swallowing always comes with the risk of aspiration because the epiglottis, when you swallow, the epiglottis covers your trachea, which is the like beginning into your airway or whatever. That also requires motor function. So with a disease like Parkinson's that's going to decrease motor function, we have a risk of aspiration as well. There's pneumonia. That's, again, related to the dysphagia because it's specifically aspiration pneumonia because when we aspirate or choke on anything, whether it's our own saliva, whether it's food or whatever, that always has a pretty good chance of introducing bacteria into our airway. And pneumonia is an infection in the lungs, so that's how that happens. We also might see UTIs. This is due to lack of sphincter control. So you have a sphincter between your bladder and the ureters, which is like the tube that the urine goes down, but that's like in your body. So you have a sphincter there, and then you have a sphincter between the outside of your body and the ureter, if I remember correctly. But we obviously lose control with that because, again, that requires motor function, and Parkinson's going to decrease that motor function, and that risks bacteria getting into the urinary tract, anywhere into the urinary tract. And then something else that kind of follows along with that is falls, because while they have a hard time controlling when they void, they can still sense when they have to void. So a patient with Parkinson's might feel that they need to void and rush to the bathroom, but they can't necessarily control when they do actually go, so then they could risk like making a mess on the floor, and then that of course can risk falls because, you know, it's like it's a mess on the floor. And then skin breakdown, of course, too. If they can't move at all, if Parkinson's has gotten to the point where they can't move at all, and they are incontinent, then it just like gets all over them.